I'd like to welcome all members of the Salis community, and I'd really like to take the opportunity to provide an update of where things stand at Salis. Since March, we've been trying really hard to keep everybody informed as we prepared for your arrival back on campus. We've been leveraging healthcare expertise from the Centers for Disease Control and Prevention and others to really develop a plan to bring you safely back to this campus, and really for those new students, those back to campus for the first time. Our Salis safety plan has been developed using guidelines from the CDC and others. Our #1 guiding principle through all of this has been that yours, our faculty, and our staff's health and safety come first. Everything that we have done has been centered around that. Putting safety first means that we have a shared personal responsibility to ensure that everybody is doing the right thing. And that means that we're protecting the health and the health of others, especially if we're going to learn and work together during this pandemic. To do our part, there are 3 very important concepts that we all have to agree will be the mainstay of our behaviors. First, social distancing. It works. We're going to give each other respect, and we're going to give each other at least 6 feet as we interact with one another. Second, hand washing. This is a powerful tool when it comes to controlling the transmission of the virus. 3, wearing a face mask. Covering your face and nose, wearing a face mask may reduce the risk of transmitting this virus down to 3%. And when you factor in social distancing, that can cut the risk even further. Practicing these concepts together is equally important off campus, where the risks of exposure really can be even greater. Remember, what you do off campus can affect all of us on campus. You're going to have plenty of opportunity to take off your face mask when you're outdoors. Actually, I would strongly encourage you to get outside as often as possible. We've set up a tent that's outside so you can enjoy eating outside, and there are also a whole bunch of Adirondack chairs scattered around the campus for you to study and just relax. If you go off campus, I would strongly encourage you to remain outdoors, especially if you decide to eat in a restaurant or even just socialize. Doing things outdoors is just so much safer than doing things indoors. Now, several of our programs have decided to remain online for much of the semester. Others require face-to-face lab training or in the clinics, and they've opted for limited classroom training. Each classroom has been set up appropriately so you can be socially distanced. In those instances, you'll need to wear your face coverings and also maintain your social distancing when you're around others as much as possible. Throughout the campus and in our clinics, we've implemented enhanced cleaning and sanitizing all over the place. And all of these are done in accordance with CDC guidelines. There are hand sanitizing stations throughout the campus and the clinic. And we've also stocked up on all the appropriate personal protective equipment, the PPE equipment that you see, that will be required in many of our clinics, and all of our clinics, frankly, and labs. We understand a big part of your campus experience is when you have the opportunity to get together and eat lunch together. Well, we've worked very closely with our new food vendor, Mets, and we've been able to make changes to our cafeteria area as well, so that the choices you'll have are really accessible when you visit there. As I mentioned earlier, we've just put out a tent so you'll be able to eat outdoors, and there's lots of grab and go options for you as well. Like all institutions around the Commonwealth, we're limited to how many people can gather together. In the state of Pennsylvania, it's no more than 25 people can be gathered in any one location. Say that 3 times fast, with the exception of classrooms and labs. I strongly encourage virtual gatherings that I'm sure you've become accustomed to when you're trying to do that. I tell you, virtual and Zoom happy hours are become a lot of fun in my family. So that's something I would strongly encourage. Our Hafter Fitness Center will be open and will be accessed by reservation. And I'm in the Learning Research Center now, and that also will be open, but there's going to be limited capacity. We've also opened a classroom that's just adjoining the Hafter Center, and that will be used for additional study space as you need it. I hope you'll agree there's lots of reasons for excitement as you come back to campus. As I've told a lot of the classes, this is a wonderful time to train. You're training under pandemic conditions. When you leave here, you will be unbelievably fantastic clinicians. You'll be ready to confront anything that comes your way. We've been working really hard to get ready, and we want you to feel safe and remain healthy when you're here. So as you prepare to begin this, what I would consider very exceptional school year, there are a few things that are really important for us to all remember as we get started. You need to remain flexible, as things can change rapidly, and we've already seen that many times. We have a shared personal responsibility and respect for each other. What you do affects my health, and what I do affects your health. We're all in this together. Two things for certain we know work: social distancing and wearing this face mask. I ask you to practice that on and off campus for the good of all of us. One more thing, these face coverings, they are going to be with us for a while. So get used to wearing them whenever you're inside or when you can't socially distance outside. I guarantee you, we're going to get through this, and we're going to get through this together because we're smart, we're responsible, and we're Salus strong. I really look forward to seeing you all around campus and moving through this together. Thanks for your time, good luck, and let's have some fun.